Hi, my name is Davia Jewell, and today I'll be talking to you about the enterovirus on the central nervous system. So what is the enterovirus? The enterovirus is a genus of the Picornaviridae family. They are highly contagious, small, positive-sense, single-stranded RNA viruses. There are over 100 different types of the enterovirus, which infect and cause illness in tens of millions of people every year, usually in the summer and fall. So who is at risk for getting the enterovirus? Infants under the age of 1 are the most at risk. However, they do commonly infect children under the age of 5 years old. Others who are also at risk of getting the enterovirus would include the immunocompromised, pregnant females, and individuals with respiratory problems like asthma. The symbiotic relationship between the enterovirus and humans ranges from commensalism to parasitism. Most individuals who become infected with the enterovirus are asymptomatic and may not even realize that they have the virus. However, the enterovirus can infect the central nervous system and induce neurological diseases. Portal of entry. The enterovirus enters the body through the mucosa of the oropharynx and the upper respiratory system. It then begins to multiply in the tissues around the oropharynx and in the gastrointestinal tract. After it replicates, the enterovirus enters into the bloodstream and then spreads from muscles to the central nervous system along neural pathways. Portal of exit. Enteroviruses leave our body through the fecal-oral route and through salivary and respiratory droplets. Modes of transmission. Enteroviruses are contagious from person to person by direct and indirect contact. This is usually from coming in contact with respiratory or salivary secretions or from the stool of infected individuals. Enteroviruses may also enter through the conjunctiva of the eye, initially producing conjunctivitis before they spread to the central nervous system. Occasionally, enteroviruses may contaminate environmental sources such as water. A side note that I wanted to include was the fact that these viruses are capable of surviving on surfaces like tables, light switches, and door handles for several days. However, avoiding contact with infected individuals, using good hand washing techniques, and disinfecting items that come in contact with infected individuals can reduce the chance of becoming infected. Over 90% of the people infected with the enterovirus are asymptomatic or they have nonspecific symptoms such as a sudden fever. The symptoms and signs of the enterovirus include flu-like symptoms such as a fever, cough, body aches and/or muscle aches, runny nose, and sneezing. The symptoms may become more severe and include difficulty breathing and/or wheezing, and those at higher risk may develop one or more of the following symptoms: shortness of breath, encephalitis, myocarditis, chest pains, weakness with paralysis, coma, and on the very rare occasions, death. Pathogenesis of the enterovirus. Enteroviruses can resist stomach acid and bile. Therefore, they can penetrate to the lower intestines where they infect and multiply in the intestinal epithelium and mesenteric lymph nodes. From there, the virus can be carried by the bloodstream to target organs such as the spinal cord, brain meninges, heart, liver, and skin. From the central nervous system, the virus can travel via neural pathways to skeletal and heart muscles. Now let's talk about the virulence of the enterovirus. Enteroviruses are considered highly cytolytic, thereby causing cytopathic effects. Different enteroviruses will target different areas of the central nervous system. And although enteroviruses possess multiple mechanisms by which they can invade the host's immune response, their success is not absolute, and the struggle between the host and the virus can last for very long periods of time. Errors in enterovirus replication can lead to the existence of viral quasi-species, which can also aid in evasion from the immune response. Now let's talk about the stages of infection. First off, the incubation period. In general, individuals are contagious about 3 days after exposure to the enterovirus, and they remain contagious until about 10 days after they develop symptoms. These symptoms usually last about a week in uncomplicated infections. Individuals can still spread the enterovirus even if they have no symptoms, or during the incubation period even after symptoms have stopped. Stages of infection number 2. Primordial symptoms. Many individuals who become infected with enteroviruses have no symptoms at all, and those who do show symptoms only have mild symptoms such as fever, headache, sore throat, loss of appetite, and abdominal discomfort. Infections usually last about a week and resolve on their own without any further problems. Stages of infection number 3. Illnesses that affect the central nervous system. Now, as I have mentioned before, there are over 100 different types of the enterovirus, and they all cause different illnesses. The top 4 illnesses that affect the central nervous system are 1. Poliomyelitis, which can lead to acute flaccid paralysis, and 2 non-polioviruses, which are encephalitis and meningitis. Poliomyelitis, also known as the poliovirus, is perhaps the most studied and characterized of the enteroviruses, especially given the clinical consequences of infection, which can infect motor neurons of the anterior horn of the spinal cord and lead to paralysis in humans. Polio mainly affects children under 5 years of age, and most people who get infected with the poliovirus, about 72 out of 100, will not have any visible symptoms. About 1 out of 4 people with the poliovirus infection will have flu-like symptoms, and these symptoms usually last only 2 to 5 days and then go away on their own. Only 1% of individuals with poliovirus infection will develop other more serious symptoms that affect the brain and spinal cord. Once polio invades the nervous system, it can cause total paralysis in a matter of hours. 1 in 200 infections lead to irreversible paralysis. Among the paralyzed, 5 to 10% die when their breathing muscles become immobilized. Even children who seem to fully recover can develop new muscle pain, weakness, or paralysis as adults, 15 to 40 years later. There is no cure for polio, but it can be prevented. Polio vaccine given multiple times can protect a child for life. Wild poliovirus cases have decreased by 99% since 1988. From an estimated 350,000 cases in more than 125 endemic countries, then to 33 reported cases in 2018. Awareness of polio increased during the 20th century. This is largely attributed to President Franklin Roosevelt, himself paralyzed from polio, who was instrumental in the founding of the National Foundation for Infantile Paralysis, which started mass worldwide vaccination campaigns. Infants infected with poliomyelitis can develop acute flaccid paralysis, also known as floppy baby syndrome. The infant will go limp, kind of like a rag doll. Ultimately, if the motor neurons to the diaphragm are affected, it can cause difficulty breathing and even death. So what is acute flaccid paralysis? It is a rapid onset of weakness of an individual's extremities, often including weakness of the muscles of respiration and swallowing. It typically affects children under the age of 15 and progresses to maximum severity within 1 to 10 days. The term flaccid indicates the absence of spasticity. AFP mimics poliomyelitis, but is rarely due to an infection with the poliovirus. Most AFP incidences are due to snake toxin or the Guillain-Barré syndrome, a rare disorder in which the body's immune system attacks its own nerves. So let's talk about encephalitis. Encephalitis is a rare condition caused by the Enterovirus 71 infection, which causes hand, foot, and mouth disease in children. Encephalitis causes inflammation and swelling of the brain. A majority of patients affected are under the age of 5 years old, but it's most often seen in the first year of life. Some of the most frequently reported symptoms include visual disturbances, vertigo, ataxia, and an overall lack of coordination. Occasionally, it induces autonomic dysfunction, such as fluctuating blood pressure and pulmonary hemorrhage/edema. It is transmitted through respiratory droplets, contaminated water or food, and vector bites. Now let's talk about aseptic meningitis. Aseptic meningitis is an inflammation of the lining of the brain and spinal cord. People of any age can get aseptic meningitis. However, some people have a higher risk of getting the disease, including children younger than the age of 5 years old and people with weakened immune systems. It spreads when an individual comes in close contact with someone who has aseptic meningitis. However, even with close contact, it is extremely unlikely that an individual will develop meningitis. Symptoms include fever, irritability, poor eating, sleepiness or trouble waking up from sleep, and lethargy, or a lack of energy. In most cases, there is no specific treatment for aseptic meningitis. Most people who get mild aseptic meningitis usually recover completely in 7 to 10 days without treatment. Stages of infection number 4, decline. The contagious period for an enterovirus infection starts about 3 days after infection and remains for about 10 days after symptoms develop. However, complications can occur in some patients and range from mild to more severe, and the infections can last longer than normal. Stages of infection number 5, convalescence. The best treatment for an enterovirus infection is prevention. For the poliovirus, there is an effective vaccine available. Unfortunately, for non-polio enteroviruses, the treatment is supportive and designed to reduce the symptoms because there are no antiviral medications currently approved for the treatment of these types of enteroviruses. Many doctors recommend using over-the-counter medications to reduce symptoms. Epidemiology. Enteroviruses are one of the most prevalent viruses in the world, meaning pandemic. And as I mentioned before, they cause an estimated 10 to 15 million or more symptomatic infections in the U.S. alone each year. Concerns for healthcare facilities. While working in the healthcare field, many individuals will come into contact with viruses and other potentially harmful diseases on a frequent basis. To better protect yourself, you should wash your hands often with soap and water, avoid close contact such as touching and shaking hands with people who are sick, clean and disinfect frequently touched surfaces and items, and wear your proper PPE at all times. My first enterovirus report comes from Contagion Infectious Diseases Today, written by Jonah Lorenz on January 10, 2020. Lorenz explains the 2018 outbreak of the enterovirus A71 in Colorado. During this outbreak, 74 children were admitted to Colorado Children's Hospital that were present with neurological diseases and enterovirus detection between March 1st and November 30th, 2018, including 43 children with the enterovirus A71. Among those children, 40 showed evidence of meningitis, 31 showed evidence of encephalitis, and 10 met the criteria for acute flaccid myelitis. It was reported that this was the largest outbreak of enterovirus A71 in the Americas to date. My second enterovirus report comes from a report out of Taiwan on October 16, 2019. This report explains how 4 children developed serious complications from the enterovirus. There were 2 2-year-olds, a 3-year-old, and an 11-year-old. 3 of the children were infected with the enterovirus A71, and 1 of them was infected with the virus A4, which is also a genus of the Picornaviridae family. The report then goes on to explain that the children had developed either encephalitis or encephalomyelitis. CDC Deputy Director General Philip Lowe states that children under the age of 5 are at an increased risk of obtaining more serious complications, especially since there had not been a large enterovirus A71 epidemic in Taiwan for many years, so most of the children and teenagers had never been infected. New therapies for treatment. With the large number of enterovirus strands circulating in nature, it hinders the promise of vaccine design against these viruses. The standard therapy for aseptic meningitis caused by the enterovirus infection continues to be intravenous immunoglobulin treatment, although its efficiency has not been proven. It is typically prepared from pools of plasma samples from healthy donors. This passive immunization-based therapy might neutralize infectious viruses circulating within the host, in addition to other nonspecific inflammatory mechanisms. New therapies for treatment. Ribavirin was first synthesized in 1972 by ICN Pharmaceuticals. It is currently under clinical development as a broad-spectrum antiviral medication. Ribavirin has been shown to inhibit the replication of a variety of enteroviruses. Picornaviridae has been developed as an anti-picornaviral drug, which has demonstrated efficiency against many enteroviruses. It is able to cross the blood-brain barrier and remain within the central nervous system at concentrations that inhibit enterovirus replication. So here's my citations. I really hope that you enjoyed my presentation, and I look forward to reading your comments.